Hello, and welcome to Lights, Camera, Baby, the show that shines a spotlight on your parenting journey from pregnancy and beyond. Igama lam Linda Mtoba, and my mother-in-law taught me something really important. She said, I'll be a mom and I'll know. But trusting your gut is really something difficult when you have a sick child. This is why you need expert advice. Thankfully, we have a wonderful panel of experts here today to give us the necessary tools and information we need to act calmly, act decisively, and take care of our babies. We have two wonderful pediatricians. We have with us Dr. Enrico Maraschin and Dr. Kevanya Coopoo joining us in studio. Welcome, doctors.
Thank you.
Thank you.
So
Thanks for the
really
invitation.
happy to have you guys here today with us.
Thank you for
Great to be
having us.
here.
As a mom, I always need to know, how do I know, doctor, if my child is sick?
Well, this is where maybe your mother-in-law is not entirely wrong. If your gut feel tells you your baby is very ill, please don't ignore that. So I always tell the parents, if you're hot under the collar, I as a doctor am hot under the collar, and it's time to act. So look out for any abnormality, but usually they start playing up a little bit initially, then they might get either a little bit feverish or a little bit lethargic, then they might become sniffly, or they might develop vomiting or diarrhea. They might have symptoms that they're just off color with nothing much to find. So urinary tract infection might give you symptoms like that. But the most important, I think, is do trust that instinct. But if your child is out of sorts, please take action.
Thank you so much for that, doctor. Dr. Coopoo, how do I know if it's a viral or bacterial infection that my child could possibly have?
So that's quite a tricky thing to elicit just on looking at your child. So bacterial and viral infections both cause similar symptoms. Whether it's a bacteria, which is an organism that attacks your body in a different way to a virus, and a virus is usually much smaller, they still give you both fevers, they both will give you a runny nose, they both can cause a cough, they can both cause bladder infections, both can cause chest infections. So actually telling the difference between them is tricky even as a doctor. And it's usually a combination of medical examination, blood tests, perhaps x-rays, a whole bunch of things that can help us get an idea. So as a parent, it's difficult for me to tell you if your child's temperature is 38.5,
It definitely means that.
It's definitely bacterial. And at the end of the day, the best thing is to know that if your child is unwell and you're unsure, take the child to the doctor. We can help elicit whether it's viral and bacterial, and that makes a difference in terms of whether we give antibiotics or not. So that's the main reason why we need to tell the difference, because it will help guide our treatment. But in terms of treating the symptoms until, you'd still use Panado to treat fever, whether it's viral or bacterial. So I think my advice would just be, don't make that decision on your own. Treat the child, make sure baby's drinking, that temperature's under control, and then seek the advice of a doctor to see whether you need antibiotics or not.
I was actually about to ask that. How do you actually treat the two differently?
Okay, so yes, bacterial infections respond to antibiotics, and depending on the type of infection, there's different types, it's a different antibiotic. So for example, not all bacterial infections will need penicillin. The thing is, viral infections, they have similar symptoms, but antibiotics don't work with them.
Wow.
So there are some viral conditions that we do use antiviral treatment for, some severe cases of chickenpox, influenza, there are antivirals that we use. But on the whole, we don't actually treat viral infections for children, and it's all symptomatic, making sure that they're comfortable and sorting out their symptoms. The frustrating thing as a caregiver is seeing that your child is suffering for a few days, because viral infections usually take about a week or so to run its course. And if it is bacterial, within 2 days of antibiotics, your child is much better. So the danger with giving antibiotics when it's a viral infection is you're not actually helping your child's illness.
Wow, yes.
B, you're giving them a drug that has side effects, because everything we give has side effects. And C, if at a later stage baby does get a bacterial infection, you've now sort of created resistance, the possibility of creating resistance, so that antibiotic, when it is needed, won't actually work. So it is a very tricky situation. But on the whole, bacterial infections need antibiotics. And most of the infections kids get actually are viral. Most
all
of the
it starts
time.
at school, all it starts
Yes,
somewhere, and then the whole
exactly.
family actually eventually ends up having it somewhere, somehow.
Exactly.
Doctor, what happens, as actually Dr. Coopoo mentioned, that what happens if it goes untreated? If a child is sick and mom says, she's going to be fine in 2 days, she's going to be fine in 3 days, what can we expect after that? What are the dangers of that?
So, look, there are times where an individual can get over an illness without antibiotics. And I think the fact that we're still in existence as a human race, is testament to that.
Yeah.
But, there are certain illnesses that left unchecked can progress dramatically. And so a lot of times we'll diagnose, yes, this is most likely viral because there's nothing to suggest that you need an antibiotic. But if that child continues to deteriorate, there is a condition where the bacteria actually invade the whole body and can even cause infection of the bloodstream. That's called septicemia. And at that point, one's got to take it one step further, which is what Kevanya was just saying earlier. You can do blood tests, you can do x-rays, you can test the urine. So don't leave it unchecked. I always tell the parents when they come in for an illness, if the child is getting worse and worse, we have to take it further. The mentality sometimes, well, I've seen the doctor, I don't have to see them again. That is incorrect. If you've seen your doctor and things are getting worse, you must go back. Don't ignore the symptoms.
Thank you so much for that, Doctor. Dr. Coopoo, you mentioned that earlier on there's different types of viral and bacterial infections. Can you maybe give us a name of few?
So as kids, children experience a whole range of bugs, which is a good thing. It builds the immune system. And you need to remember that each type of infection can be caused by both viruses and bacteria. So something as simple as an ear, nose, and throat infection can be caused both by bacteria, example strep, or it can be caused by a virus. So your normal influenza can cause a ear, nose, and throat infection as well. So it's difficult to go through the entire list because there are millions of organisms. But the common ones that we get in our childhood population luckily are covered by the immunizations that children receive. So the big ones, your polio, your hepatitis, chickenpox, tetanus, diphtheria, all the dangerous sort of bugs, measles, they are covered in vaccines. So I think that's just alluding to the fact that as Dr. Enrico mentioned earlier, vaccinations are so important.
Yes.
And just keeping your children on the immunization schedule, you're already protecting them from most of the organisms that they're likely to encounter.
That is absolutely amazing. Thank you so much for the information. Parents, I know you guys have your notepads out. Please, if not, go get yours because we still have more questions here with our doctors. We'll be right back after this quick break.
Your hug tenderly cares for your baby. Our hug gently protects his delicate skin. Huggies Extra Care is our gentle protective hug with soft pillows that absorb mess in seconds to protect newborn skin. An extra wide stretchy waistband and unique runny poo pocket for better leakage protection. Huggies Extra Care, now available in sizes 3, 4, and 5.
Huggies has a hug for every moment, and we show our love through giving to our incredible community of moms. Follow this week's unique link for Lights, Camera, Baby. Complete the form and submit your details. Stand a chance of winning your share of 50,000 Rand in Huggies vouchers. Every week, 100 viewers will each receive a 50 Rand discount voucher off the next purchase of Huggies diapers. The great news is you can enter each and every single week. Share the love, share the hug, and get your community to enter too. As we said, today is Ask the Doctor, and we do have a question from a mom.
Hi, I'm Nicole, and a mom of 3, and I have a question for the doctor. When one child gets sick, everyone gets sick. How do I stop the spread or prevent it?
Thank you so much for that question, Dr. Enrico.
Yeah, so look, maybe COVID has taught us a lot of things. Certainly there's the social isolation, there's the sneezing into your armpit, there's wearing masks, I think would be overkill in a non-COVID setting. But, you know, you can isolate your child from the outside world when they're ill. So, for example, don't send them to school, don't send them on a play date, don't send them on their swimming lessons. But you can't really isolate your child from your family. And unfortunately, it is a bit of a reality that you know, if there's a bug in the family, it does spread from person to person, which, as Kevanya was saying earlier, it's not a problem. We all got to develop our immunity. But we are punting always the vaccines. And honestly, I've been in private practice for 26 years. And if there's anything that keeps your child out of hospital, it's your vaccination. So prior to vaccinating to various bacteria, we used to admit a lot of kids with pneumonia, ear infections, a lot of grommets and so on. And since we've introduced that, we have very few of such infections. And the introduction of the rotavirus vaccine, we used to admit about 4 cases of rotavirus per doctor per week to hospital.
No.
The day we introduced that vaccine, we stopped admitting children to hospital.
Amazing.
So the quality of life of your child is now much better because now you're treating a mild gastroenteritis at home rather than having them admitted to hospital. Numerous pricks, numerous blood tests, horrible admission, terrible experience of having to be in hospital.
Yes.
So please vaccinate
it really
your
starts
kids.
early. Vaccinate and vaccinate and vaccinate.
Just
Today,
keep
the spotlight is
vaccinating.
definitely on you, doctors. We have so many questions. We do have another question from my mom.
Hi, doctor. My name is Lauren, and I'm a mom of 2. Can I give my 2- and 4-year-olds over-the-counter cough medicine? What is the best way to treat?
Thank you so much for that question. Dr. Coopoo?
So I'm so happy that question was asked because a lot of parents actually do ask me this. And cough medicines are a no-no for kids.
Really?
It's not something that as pediatricians we advocate, and it's important to remember what a cough is to begin with. A cough is a symptom. It's not the actual disease. So why is my child coughing? Is it a chest problem? Are they coughing because something's irritating their throat? Is it a cardiac issue? And the important thing is to get to the underlying cause. So if your child has a pneumonia that's bacterial and causing a cough, they need to be on an antibiotic. If the child is asthmatic and has a tight chest, then they need to be on an asthma pump to relieve that cough. So the important thing with kids is to get to the underlying cause. And cough is just a defense mechanism. It's your body's way of getting rid of whatever's in your airways to clear it out. So suppressing a cough in kids isn't a good idea. There have been studies that have proven honey is very good. But I have to say a big but for the moms. Under a year old, you shouldn't be giving your kids honey. So if your child is older and your kids are 2 and 4, you can take some honey, put it in warm water. It does soothe the throat. But other than that, unfortunately, it's about treating the underlying cause of the cough and to avoid cough syrup.
Speaking about coughing, when a child is coughing and maybe has difficulty breathing, Dr. Enrico, is that something for us to stress about and worry about?
So a child who has difficulty breathing really shouldn't be treated at home. So often children who have croup at 3 a.m, the parents say, oh no, we were nearly going to casualty. If your child is struggling to breathe, you mustn't nearly go to casualty. You must go to casualty. You must seek medical help and advice. And another sign, not only shortness of breath, but agitation. A child who's lacking oxygen will get very agitated. So please don't ignore those symptoms. That requires a child to go and get medical attention urgently.
Yeah, thank you so much for that, doctor. We do have one more question. I said the spotlight is on you, doctors. We have one more question from my mom.
My name is Daniela and I am a mom of 3. My question for the doctor is, what do I do if my little one gets something stuck in her throat and starts choking? Thank you.
Thank you so much for that question. Dr. Coopoo, would you like to answer that for us?
Sure. So getting something stuck in your throat is known as choking, and that is a medical emergency. So the most important thing in any emergency is to remain calm, because you can't help your child if you need to help yourself. So
Wow.
stay calm, take a breath, and get into action mode. So the first thing is, if your baby is under a year, then you would take baby, put him or her over your lap, and give 5 big slaps to the back, okay? And hopefully by that stage, the object will come out. If the child is a bit older, you can do the Heimlich maneuver. The important thing, and it has been mentioned before, that every family should have the members of the household have some sort of basic resuscitation skills,
CPR.
whether it's a basic CPR course or basic life-saving course. I think it's very empowering for every family member to have that. So if a situation like this happens, you'll be empowered.
Yes.
But I think the important thing is to always just remain calm. And in the case of your child having something stuck, if they're coughing, that's a good sign. That
Okay.
means they're able to
Get oxygen
They
in.
have air flow through their lungs. So coughing is a good thing. But just act fast and be calm, and that's what I can advise.
Thank you so much for that input, doctors. We really, really do appreciate it. Of course, it's important for us as parents to know and understand all this information, but quite honestly, I can feel it's sometimes overwhelming. So after the break, we'll bring into our homes and look at the most prevalent childhood diseases. Moms, dads, and families watching, you know we love to give you some love, and we're doing just that with giving away a fabulous Huggies hamper. Subscribe to our channel, Mama Magic SA on YouTube, and tell us what's your must-have medicine in your cabinet. Share it on Mama Magic's Instagram and Facebook feed, tag at least 2 friends, and you could be a winner of a sensational Huggies hamper. Welcome back, moms and dads, in this endless sea of possibilities. And for the sake of what we're able to fit into the show, we're narrowing our discussions down to 5 or 6 most common baby and early childhood ailments that parents will more likely be faced with at some stage of their lives. Dr. Enrico, when we're all at home and the common ailments that one can face, what are the most common ones that we actually do experience at home?
So, as Kevanya was saying earlier, most of illnesses that children get and need to develop their immunity to are viral. And certainly because we're all breathing and we're all exchanging the same air, the upper respiratory tract infections are certainly the most common. And 80% of upper respiratory tract infections are viral, and those include all the parts of the respiratory tract, be it the nose, the ear, the throat, and then sometimes it travels down into the trachea and the lungs as well. Other common infections, skin infections. It's the largest organ of the body, so we do get, most infections that affect the skin are rashes,
Yes.
which are viral, but you can also get bacterial infections that invade the skin locally and almost eat away the skin, and that requires treatment. Urinary tract infections are common, and we should have maybe even mentioned earlier, gastroenteritis is a big infection.
Yes.
The other big exposure to the body is taking in food and swallowing stuff, and in there, be it in the food or being in the water that you drink, there can be contamination with either viruses or bacteria, which then would cause gastroenteritis. And then in turn, each other system of the body can get infected,
Yes.
but those are a lot less common.
Yes. So infections are a common thing. Dr. Coopoo, would you mind telling us about hand, foot, and mouth?
So hand, foot, and mouth disease is actually caused by a group of viruses called enterovirus, and the main one being Coxsackie. We get Coxsackie A and B. And luckily, most of the time, the symptoms are quite mild. It may present sort of as a tummy bug, a bit of diarrhea, vomiting. Some kids get the hand, foot, and mouth disease rash. So it's a rash around the mouth, on the hands, the soles of the feet. So that's usually where the disease ends. In rare cases, it can progress, and some kids can have inflammation of their heart muscle, and some kids can have the disease affect their nerves as well, causing something called Guillain-Barré. But those are two rare outcomes, and most of the time it's usually limited to tummy bug sort of symptoms, just diarrhea and vomiting.
Wow, it really just seems like so much can happen at home, but having professionals on our sides truly, truly does make our lives a whole lot easier. Speaking about diseases and actually treating them, what happens if my child is allergic to penicillin?
So penicillin is the commonest used antibiotic, and therefore probably one of the more common allergic reactions one would have to an antibiotic, but one can be allergic to any antibiotic or any treatment that we use as doctors for that matter. So the reactions can be mild or they can be severe. So you might have something as mild as a person taking penicillin, they might just have a rash around their mouth, or if it progresses and it's more severe, it can cause a reaction on the skin. So a mild skin reaction might be something as simple as eczema or a drug reaction, or it can be quite violent where you actually get it's called an urticaria, very big blotchy rash. You can even get swelling of the body at times. And in more extreme circumstances, you can also get what's called an anaphylaxis, where you get an immediate violent reaction to the body, which may include the reaction on the skin, but it also then closes your throat and makes it difficult to breathe, and in fact can even become a life-threatening situation.
So always call a professional. Likely if you're getting penicillin shot, you're being given it by someone who's actually a professional in the field. Dr. Coopoo, speaking about getting shots and actually getting fevers, what happens when a person has a fever and how can one actually break the fever? What's the best remedy to maybe try at home?
All right, so that's a good question. All kids have suffered with fever at one stage or another. And fever is basically your body's reaction to an invader, whether it's a bacteria, whether it's a virus, and something with the actual wall of the bacteria or about the chemicals secreted from the bacteria causes a reaction in your body, which causes your body to raise the temperature.
Yes.
Now, the good thing about this is that bacteria and viruses function at certain temperatures. So the body tries to increase the temperature to make sure that the bacteria and viruses can't function. So fevers actually are protective, and a high temperature will actually prevent the bacteria from spreading and the viruses from spreading.
Amazing.
Saying that, though, it is a miserable thing to have a fever. You lose your appetite, your body is sore, you're cranky, and it is good definitely for the infection. But at the end of the day, your child needs to be comfortable as well. So breaking the fever, you can do either through medication or without medication. So without medication, it's something as simple as maybe undressing your child, letting them sit in their underpants or their pants, maybe taking a warm face cloth, wet warm face cloth, and dabbing them. The trick is not to get them too cold too quickly.
I actually always thought it was supposed to be a cool cloth.
It's a shock to the system, and if you actually drop the temperature too quickly, it actually can cause more issues as well. So it's about putting the child in a lukewarm bath, a warm face cloth, just taking off the top. And if you want to use medication, the main two medications we use is either ibuprofen, which is a non-steroidal anti-inflammatory, or paracetamol. So I advise parents to use either of those, but not both.
Okay.
So try your Panado, your paracetamol, see how your child responds, and if it doesn't work, then you can try your ibuprofen. And the most common reason that these medications don't work is actually parents are scared to use the right dose. So always just look on the bottle and read. If your child is this amount of kilos, use this amount of moles.
Age, yes.
I've
Great
seen a lot of
advice.
kids that are actually underdosed and their fever doesn't break, but it's just a matter that they weren't given the right
Speaking
amount.
about the fever breaking, quite quickly, Dr. Enrico, why the importance of the fever actually breaking?
So look, if the fever is low grade, it's not a train smash, and it's nice to control because the child is miserable, and if we control their symptoms, they might eat and drink better, and eating and drinking better supports the system, and the child might recover well. However, there are rare occasions, which are not that rare, where the fever can spike up very high, and a sudden raise in temperature can alter the metabolism in the brain, and the child can actually get fever convulsions, which is a very frightening thing to
Yes, I'd
see.
imagine
I think
so.
any parent that's experienced that, who's not really in the know, thinks their baby's dying.
Yes.
So at that point, it is important to get the fever down, settle the child down, and that usually does require medication. And if you don't have medication at home, or certainly a child who's fitting is hard to administer medicine, so often it does involve suppositories. So if you don't have that available, you might have to get to your nearest emergency centre, and the doctor will take over at that point.
Thank you so much, doctors. You know, as a new mom myself, I've learned so much today. Thank you for all the information. I know that so many other moms right now have taken down their notes and they're probably going to watch this over and over again. Thank you so much for information. Your support structure is super important when you're dealing with a sick child. Make sure you have a GP or a wonderful pediatrician, like we do right here, or even a pharmacist or nurse that you're able to speak with and that you're comfortable and that you trust. To all our wonderful guests, thank you for sharing your wealth of knowledge and experience with us today. Become a part of the Lights Camera Baby community by subscribing to our channel that you're watching right now, Mama Magic SA, and of course follow us on Instagram and on Facebook at Mama Magic SA.
Do you know about stem cell banking? Have you considered this for your baby and their future? Banking your baby's stem cells is a form of medical insurance that you hope you never have to use. Stem cells are the original building blocks of life and can help treat over 80 blood-related diseases. Contact NetCells today to learn how you can safeguard your baby's future.
You've spoken and we've listened. That's why our gentle protective hugs have grown. The Huggies Extra Care range you know and love is now available in sizes 3, 4, and 5, with soft absorbent pillows and a unique runny poo pockets for extra leakage protection. Huggies Extra Care is also clinically proven hypoallergenic for newborn skin protection. Give your baby the best care they deserve with Huggies Extra Care. Huggies, your hugs inspire ours.